Hi, it's time for another Things I Like. As many of you may know, I am a nurse and I've been a nurse about 2 years. I heard that there was a medical-based video game and I didn't really give much thought to it. I said, how good of a game could this really be? It's a pretty flippin' sweet video game. So this game, Trauma Team, has become one of my favorite video games. This game is a story-based game. Think of it as Grey's Anatomy and ER storylines mixed with gameplay. It's almost told in graphic novel form. In the game you follow 6 different doctors and they each have different specialties. But their stories sort of intertwine with each other and you see how they interact with each other through cutscenes. This video game is rated T for teen, and there are a lot of language issues as well as partial nudity. This is not a game for the kiddies. Partial nudity as meaning you see somebody in their bra, which for me, I see that every day, so it's not really that big a deal for me. Some people, that would be a very big deal for them.
Trouble using the toilet fully? In other words, well, let's just be frank about it. It's nothing to be embarrassed about, right?
But I find that there's sort of that double standard where they're swearing up a storm, but they can't say constipation. Really? That's where we're going to draw the line, is talking about bowel functions. I have to warn you, it is anime, so it gets really Japanese at times. Some of the storylines are kind of bizarre, would never happen in real life. For example, there's a doctor called Dr. Freebird, and he looks like Elvis on steroids. His alter ego is Eagle Man, and he is a superhero. Dr. Freebird is orthopedics, and I sort of work in orthopedics as a nurse, so it's very kind of cool to see all this stuff and, to put screws and rods and pins into your patients. There's another doctor who is a really gifted surgeon. He doesn't even have a name because he lost his memories. He's a prisoner because he is on trial for a bunch of bombings that occurred, but he lost his memory. So he's working at the hospital in order to pay back a debt to society. There's also Dr. Maria Torres, who is just this foul-mouthed, angry, bitter doctor who does rapid response and emergency services. I would say that's my favorite part of the game, is the emergency services. I don't think I could ever work in the ER, but I can definitely play this video game. Dr. Gabe Cunningham, he works in diagnostics, and that's another of the games that I really enjoy playing, is diagnostics. What I find so great is that you can not only ask the patient questions and pick up on different things that you would ask your patient about, but you can compare heart sounds, bowel sounds, lung sounds with normal sounds and see whether the patient is normal or not. You can also look at their x-rays, their CT scans, and find any abnormalities that are going on in their scans, and that can lead you to a diagnosis.
Fluid and gas in her intestine. It's a NIVU, Roni, an air fluid level.
The computer system, Roni, gives you all of the possible diagnoses for the patient, and then you can click and drag all the symptoms in there and see which is the best possibility for diagnosis, which is what I do as a nurse and what I see doctors doing all the time. For being a video game, it's pretty realistic gameplay. Now, you can't diagnose yourself, that's just stupid. My other favorite part of the game is Dr. Kimishima. She does the forensics. And in the forensics, you actually look at the corpse and the patient's final effects, and you see if you can find any clues. You have those clues analyzed. You can even look at family members and people that were there at the time of death, their testimonies, and see if there's any discrepancies in their testimonies to solve the mystery. I also like that you can spray like that aluminum powder and that special light powder and put the little light around and see where blood is in the crime scene room. A couple of the negatives with this part of the game is that it takes a long time to do the gameplay. I was, capturing my gameplay for this vlog, and it took over 2 hours to complete one episode of her game. in comparison to maybe a 10-minute surgery. The only doctor that I could do without, and I don't play that as often, is the endoscopy doctor. Her storyline's really weird. She's like some sort of ninja mystical being, and not only that, but I find the endoscopy controls very, very hard to do. You sort of thread it through to the TV, which is kind of cool because it's the realistic motion, but it's very, very difficult to keep that motion up during your gameplay. The thing that I love the most about this video game is the controls. I've played many Wii games before, but this game has a lot of variety in controls and how you do different actions in the game, whether it's holding a combination of A and B down when you're using your scissors, or grabbing the gauze, or with the AED machine, using the paddles, or doing CPR on your patient, wrapping bandages. There's just a lot of different motions that you can go through that a lot of Wii games just don't have. The downside to this is that when you're doing an operation, it is very, very sensitive, and that is part of the gameplay though, is that you're being a doctor and you have to be very precise in your movements, especially when you're using a laser to excise a tumor. And it's also really cool because I have Wii motionplus, so a lot of the actions actually come through my controller. So, for example, when the pager goes off for Dr. Kimishima for forensics, the Wii controller actually vibrates and you can hear the phone call coming through the controller, not just the TV. So that's awfully cool. Out of all the controls though, I find it funny, I have the most difficulty with tying a tourniquet. And that's funny to me because that was one of the things that I had the most difficulty with in real life. I am awful at sutures. They just are zigzagged all over the place. It's really bad. Things that aren't really realistic, it is way too easy to put an IV in a patient in the game versus real life. So although this game is an older Wii game, it's really, really fun. I know that there are other chapters and newer versions of the game, but I've heard that this one, the original, is the best. So this video game is really, really fun, and it's great to play on your day off between 12-hour shifts. So put your comments down below. Let me know if there's any video games that you've been playing lately that you've really enjoyed. I'm always looking for new video games that I can play. Until next time, see you guys.